Welcome to all of you, and today I am taking one question, and the question is for Genius Baby Framework Workshop. Sir, why this course is a must for every pregnancy? Why you are saying so? So this is the question which has been asked to me very frequently. So I want to answer this question that I am not creating any panic that you should join this course. Number one point, not at all. But as a doctor, I am facing babies struggling with such type of problems, issues nowadays which have their roots in the pregnancy period. And without purifying pregnancy period, we cannot minimize the risk of these problems like autism, like hyperactivity disorder, attention deficit hyperactivity disorders, some other behavioral issues, schizophrenia, low babies in immunity and in birth weight. So there are some roots, they have some roots in the pregnancy period, and you have to rectify those issues which are linked to pregnancy period. This is my point of emphasis. Okay, number one. Now today I am discussing the first reason of it. Stress is a major risk factor. You all know that stress during pregnancy influences baby's brain development. You all know this thing. It is so easy to say, but it is not so easy to rectify this problem. So number one point I want to say you that in a very short term stress period during pregnancy does not harm our babies. Okay, even such period is necessary for brain development because our baby's brain is exposed to ultra short term stress periods. He becomes familiar to these stress levels, so minor stress levels. Okay, but if our babies face long term stress period during pregnancy, if mother is stressed for long term during, then this creates, this hinders proper brain development in our babies, and that is the place where we need to interfere. But we will interfere when we will know that either we are suffering from chronic stress disorder or either we are suffering from acute stress disorder, very short term stress disorder or very long term stress disorders. Is that clear to you? And you all know that most of us do not accept that we are in stress. Most of the times we refuse that we are stressed or we are depressed. Is that clear to you? Okay. So here I am taking some examples of stress. Okay. Now number one point is, you can look here, that is financial stress. Okay. Like job disruption of mother due to pregnancy. Second is job problems with husband. Third one is the place change during pregnancy due to job. Okay, nearly nil savings in your saving account. There is no saving left for pregnancy period. Okay, and there are some serious health ailments or issues which needs huge expenses during pregnancy or after delivery. So all these conditions definitely creates stress to mother, and these conditions may create a long-term stress scenario, and thus they impact our baby's neurodevelopment. They hinders proper neurodevelopment during pregnancy if mother is stressed due to financial reasons. So here the stress needs some typical type of treatments, some typical type of preparations which you must learn. Okay, now I am taking one another example, and that is family conflicts. Here what happens, there are conflicts of ideas in between husband and wife. Okay, but if they become a major issue, then they may lead to chronic stress disorders. Okay, now wife and other family members idea issues or family conflicts. Third one is in your job, your conflicts from your seniors. On regular basis we face some such type of problems. Okay, and third and most important is your wandering mind. we do not know how to fix our own mind. And fifth is dowry problems, and last is divorce during pregnancy period, which definitely hampers mother mind, lends mother mind into a chronic stress problem, and thus impacts our baby's proper neurodevelopment. And now the strategy to deal family conflict stress is different from job stress. Is that clear to you? So here you need some other type of remediations, some other type of treatments or guidances. Okay. Another thing which you have faced during COVID times and in sudden accidents, sometimes we lose our loved ones forever. And this thing creates a chronic stress in our mind, and this stress is sometimes of like that we wake up at midnight watching that incident, watching that bad incident, maybe that an accident, maybe that and losing a loved ones. And this chronic stress problem creates a vicious cycle, and we are sometimes unable to break that vicious cycle, and that is known as post-traumatic stress disorders. During COVID times, the cases of PTSD have been increasing. Okay, that may happen due to accidents, post-COVID stress, loss of loved ones. Okay, so here the treatment modality is entirely different from those two previous ones which you have seen. Here you need some different type of techniques and tactics to deal with. At least a minimum level of techniques and tactics you should know. Why I am saying so? Because most of the time when we are under depression, we do not accept that we are depressed. When we are stressed, we do not accept, we show that we are happy, and exactly we are different what we are showing. But what we are from inside, that impacts our baby. If we are depressed inside, if we are stressed inside, that is going to hamper proper neurodevelopment of our baby. Whatever we are showing to society is entirely different. You may look to some people very happy, laughing, but you cannot escape from your baby. He is watching you during pregnancy. He is taking each and every feeling, each and every neurohormone from you. So if you are stressed, then you must accept this thing, you must treat this thing, and at least you must know some remedies for that, because it's a different type of stress you are looking here. Now, next type of stress is shifting stress. What is this? We were living in a combined family, now we started living in a city, means shifting from combined to nuclear family. Who will care then? What is the problem here is, who will care us during pregnancy period? Question number 1. Who will take care of our baby after delivery? Question number 2. If we have strong family conflicts, then this is shifting stress definitely becomes a chronic stress. Now this chronic stress is not arising at the end of the pregnancy period, means at the delivery. It engulfs us since starting of the pregnancy period. Okay, if in first trimester we face this issue, then we get stress, and that stress may last for 9 months or more longer. Okay, so you have to deal these things very tactically. What you should do during pregnancy period if such things happens is must for you to know. Now I am moving to pre-existing diseases. So the stress due to pre-existing diseases, like if you have diabetes mellitus, if you have thyroid problems, if you have higher blood pressure levels, means hypertension, then definitely these diseases creates two types of problem. One, due to disease you are facing, and another, you think that what will happen to our baby, will these problems also engulf our baby or not? And these questions needs proper counseling, proper answers. Okay, and if you have such type of stress throughout your pregnancy, that what will happen to you and what will happen to your baby, you are taking another type of stress in your life, and that is also going to harm our baby's neurodevelopment if it exceeds of, or if it becomes of chronic type. Okay, so the most important thing I want to discuss with you, that leave your diseases to your doctor. Rule number 1. Rule number 2, then you should not think about your diseases will transmit to your baby or not. You can discuss all these issues with your doctor and he will answer you all the things. Okay, leave this stress as early as possible, because remember, diabetes, thyroid and hypertension will be treated by your doctor, and either they will harm or not is a secondary question. But if you have such type of thinking and chronic stress you creates in your mind, that too will definitely harm your baby. Is that clear to you? So leave these questions to your doctor and ask him. Most important thing I want to discuss with you is that you are always taught about the fear of labor pains. You always watch some type of movies, okay, where you see that during delivery mother died and baby become Abraham Lincoln, means a great man. Okay, so such type of movies, such type of short spell nataks as you see, so please avoid all these things. Fear of labor pain, either your baby is going to deliver through normal delivery or either he is going to be delivered via cesarean operation. Please leave this fear, and this fear usually engulfs a mother since beginning. And remember, the answer to this question is decided at the final point via your doctor. You should follow your doctor in this regard. You should not force anything that you are going to through normal or you are going to cesarean. There is a medical assessment methods to decide these things. So you need not to take load or stress due to fear of labor pains. Is that clear to you or not? Now, reason matters, and the question is how to de-stress. Most important thing I want to discuss with you is that you are always taught that doing yoga, doing meditation, doing some exercises and doing some extraordinary works will make you de-stress. Now the question mark is, I have discussed 5 to 6 types of the stress which you may face during pregnancy. Do you think that only doing yoga and meditation you can get de-stressed? Yes, you can create a state of tranquility for few hours and the stress will again engulf you. I am not against yoga and meditation. I am saying one most important thing here. Please pick my point. My point is you should learn that each scenario of stress is different from others. One type of stress in all persons are not equal level. First thing, stress reasons are different in different persons. Many times we have multiple type of stress problems. So you have to rule out the problems associated with stress first. Number one, if you learn to deal with these problems practically, then only you can get rid of these false creation of stress things through yoga, meditation and exercises and all other things. Just imagine, if I have not food to eat in the evening, can I meditate? And can I through meditation can I get rid of that stress that I have no money to eat in the evening? No. So you have to do the proper practical work. Then yoga, stress and meditation, each and everything will definitely benefit you. They will benefit you because most of the times we take stress from those things which are not actually present, which are man-made, which are the creation of our wandering mind. So those type of stress which we makes by ourselves through our wandering mind, through our wandering nature, those are subsided by yoga, meditations and exercise. Okay, so I want to emphasize that use practical things to deal with stress. Number one, use yoga, meditation and exercise to deal with your extra stress which you creates falsely, which our minds creates falsely. Is that clear to you? So I am not against yoga, meditation and all these things, but I want to emphasize that reason should be treated first, and then all those things should be done simultaneously. Okay. So what can you do to treat the reason? I have discussed 5 types of stress to you, 5 to 6 types of stress. So plan it beforehand. Before you get pregnant or during pregnancy, you must know that these types of problems can engulf us and there are chances. So you have to do 5-point strategy. First, pre-pregnancy or during pregnancy, your planning should be there. You should learn the concepts to deal with these types of stress problems. Number third point is then you should discuss these problems with open hearted in your with your husband and with your other family members. Okay, because your baby is very precious. Now after discussion you should plan a strategy how will you do the things, and after planning a strategy you should implement the things. How will you do all these things? With planning, learning the concepts, discussion with your family members, propagating a strategy, and finally implementing it to de-stress ourselves. So I want the things to be practical, not to be theoretical. So be practical, be learn all the things what the essential 10 to 15 points each stress needs demands from you, because most of the times we do not accept that we are stressed. Hope you have got my answer that this genius baby framework needs simple, single, important steps taken by the mother very actively, very precisely, and all the things affect mother's brain will affect baby's brain too. Hope you have got my answer, and the reason to why you should join this workshop or you should learn at least from anywhere in this world, why you should do some preparations before pregnancy, we will discuss in the next video. Thank you.